Section 29 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Trigeminal Nerve, Part 2. Branches of distribution. These are divisible into four groups, viz., orbital, palatine, posterior superior nasal, and pharyngeal. The orbital branches, rami orbitalis, ascending branches, are 2 or 3 delicate filaments which enter the orbit by the inferior orbital fissure, and supply the periosteum. According to Luschka, some filaments pass through foramina in the frontoethmoidal suture to supply the mucous membrane of the posterior ethmoidal and sphenoidal sinuses. The palatine nerves, nervus palatini, descending branches, are distributed to the roof of the mouth, soft palate, tonsil, and lining membrane of the nasal cavity. Most of their fibers are derived from the sphenopalatine branches of the maxillary nerve. They are 3 in number, anterior, middle, and posterior. The anterior palatine nerve, nervus palatinus anterior, descends through the pterygopalatine canal, emerges upon the hard palate through the greater palatine foramen, and passes forward in a groove in the hard palate, nearly as far as the incisor teeth. It supplies the gums, the mucous membrane, and glands of the hard palate, and communicates in front with the terminal filaments of the nasopalatine nerve. While in the pterygopalatine canal, it gives off posterior inferior nasal branches, which enter the nasal cavity through openings in the palatine bone, and ramify over the inferior nasal concha and middle and inferior meatarses at its exit from the canal. A palatine branch is distributed to both surfaces of the soft palate. The middle palatine nerve, nervus palatinus medius, emerges through one of the minor palatine canals and distributes branches to the uvula, tonsil, and soft palate. It is occasionally wanting. The posterior palatine nerve, nervus palatinus posterior, descends through the pterygopalatine canal and emerges by a separate opening behind the greater palatine foramen. It supplies the soft palate, tonsil, and uvula. The middle and posterior palatine join with the tonsillar branches of the glossopharyngeal to form a plexus, circulus tonsillaris, around the tonsil. The posterior superior nasal branches, rami nasalis posteriores superiores, are distributed to the septum and lateral wall of the nasal fossa. They enter the posterior part of the nasal cavity by the sphenopalatine foramen and supply the mucous membrane covering the superior and middle nasal conchae, the lining of the posterior ethmoidal cells, and the posterior part of the septum. One branch, longer and larger than the others, is named the nasopalatine nerve. It enters the nasal cavity through the sphenopalatine foramen, passes across the roof of the nasal cavity below the orifice of the sphenoidal sinus to reach the septum, and then runs obliquely downward and forward between the periosteum and mucous membrane of the lower part of the septum. It descends to the roof of the mouth through the incisive canal and communicates with the corresponding nerve of the opposite side and with the anterior palatine nerve. It furnishes a few filaments to the mucous membrane of the nasal septum. The pharyngeal nerve, pterygopalatine nerve, is a small branch arising from the posterior part of the ganglion. It passes through the pharyngeal canal with the pharyngeal branch of the internal maxillary artery, and is distributed to the mucous membrane of the nasal part of the pharynx, behind the auditory tube. The pharyngeal nerve, pterygopalatine nerve, is a small branch arising from the posterior part of the ganglion. It passes through the pharyngeal canal with the pharyngeal branch of the internal maxillary artery, and is distributed to the mucous membrane of the nasal part of the pharynx, behind the auditory tube. The mandibular nerve, nervus mandibularis, inferior maxillary nerve, supplies the teeth and gums of the mandible, the skin of the temporal region, the auricula, the lower lip, the lower part of the face, and the muscles of mastication. It also supplies the mucous membrane of the anterior 2/3 of the tongue. It is the largest of the 3 divisions of the fifth, and is made up of 2 roots, a large sensory root proceeding from the inferior angle of the semilunar ganglion, and a small motor root, the motor part of the trigeminal, which passes beneath the ganglion and unites with the sensory root just after its exit through the foramen ovale. Immediately beneath the base of the skull, the nerve gives off from its medial side a recurrent branch, nervus spinosus, and the nerve to the pterygoides internus, and then divides into two trunks, an anterior and a posterior. The nervus spinosus, recurrent or meningeal branch, enters the skull through the foramen spinosum with the middle meningeal artery. It divides into two branches, anterior and posterior, which accompany the main divisions of the artery and supply the dura mater. The posterior branch also supplies the mucous lining of the mastoid cells. The anterior communicates with the meningeal branch of the maxillary nerve. The internal pterygoid nerve, nervus pterygoideus internus. The nerve to the pterygoideus internus is a slender branch, which enters the deep surface of the muscle. It gives off one or two filaments to the otic ganglion. The anterior and smaller division of the mandibular nerve receives nearly the whole of the fibres of the motor root of the nerve, and supplies the muscles of mastication and the skin and mucous membrane of the cheek. Its branches are the mesenteric, deep temporal buccinator, and external pterygoid. The mesenteric nerve, nervus mesentericus, passes lateralward above the pterygoideus externus, in front of the temporomandibular articulation, and behind the tendon of the temporalis. It crosses the mandibular notch with the mesenteric artery to the deep surface of the masseter, in which it ramifies nearly as far as its anterior border. It gives a filament to the temporomandibular joint. The deep temporal nerves, nervus temporales profundi, are two in number, anterior and posterior. They pass above the upper border of the pterygoideus externus and enter the deep surface of the temporalis. The posterior branch, of small size, is placed at the back of the temporal fossa, and sometimes arises in common with the mesenteric nerve. The anterior branch is frequently given off from the buccinator nerve, and then turns upward over the upper head of the pterygoideus externus. Frequently a third or intermediate branch is present. The buccinator nerve, nervus buccinatorus, long buccal nerve, passes forward between the two heads of the pterygoideus externus, and downward beneath or through the lower part of the temporalis. It emerges from under the anterior border of the masseter, ramifies on the surface of the buccinator, and unites with the buccal branches of the facial nerve. It supplies a branch to the pterygoideus externus during its passage through that muscle, and may give off the anterior deep temporal nerve. The buccinator nerve supplies the skin over the buccinator, and the mucous membrane lining its inner surface. External pterygoid nerve, nervus pterygoideus externus. The nerve to the pterygoideus externus frequently arises in conjunction with the buccinator nerve, but it may be given off separately from the anterior division of the mandibular nerve. It enters the deep surface of the muscle. The posterior and larger division of the mandibular nerve is for the most part sensory, but receives a few filaments from the motor root. It divides into auriculotemporal, lingual, and inferior alveolar nerves. The auriculotemporal nerve, nervus auriculotemporalis, generally arises by two roots, between which the middle meningeal artery ascends. It runs backward beneath the pterygoideus externus to the medial side of the neck of the mandible. It then turns upward with the superficial temporal artery, between the auricular and condyle of the mandible, under cover of the parotid gland. Escaping from beneath the gland, it ascends over the zygomatic arch, and divides into superficial temporal branches. The branches of communication of the auriculotemporal nerve are with the facial nerve and with the otic ganglion. The branches to the facial, usually two in number, pass forward from behind the neck of the mandible and join the facial nerve at the posterior border of the masseter. The filaments to the otic ganglion are derived from the roots of the auriculotemporal nerve close to their origin. Its branches of distribution are anterior auricular, branches to the external acoustic meatus, superficial temporal, articular, parotid. The anterior auricular branches, nervus auricularis anteriores, are usually two in number. They supply the front of the upper part of the auricula, being distributed principally to the skin covering the front of the helix and tragus. The branches to the external acoustic meatus, nervus meatus auditorii externi, two in number, enter the meatus between its bony and cartilaginous portions and supply the skin lining it. The upper one sends a filament to the tympanic membrane. The articular branches consist of 1 or 2 twigs which enter the posterior part of the temporomandibular joint. The parotid branches, rami parotidae, supply the parotid gland. The superficial temporal branches, rami temporales superficiales, accompany the superficial temporal artery to the vertex of the skull. They supply the skin of the temporal region and communicate with the facial and zygomatic temporal nerves. The lingual nerve, nervus lingualis, supplies the mucous membrane of the anterior 2/3 of the tongue. It lies at first beneath the pterygoideus externus, medial to and in front of the inferior alveolar nerve, and is occasionally joined to this nerve by a branch which may cross the internal maxillary artery. The chorda tympani also joins it at an acute angle in this situation. The nerve then passes between the pterygoideus internus and the ramus of the mandible, and crosses obliquely to the side of the tongue over the constrictor pharyngis superior and styloglossus, and then between the hyoglossus and the deep part of the submaxillary gland. Finally it runs beneath the duct of the submaxillary gland and along the tongue to its tip, lying immediately beneath the mucous membrane. Its branches of communication are with the facial, through the chorda tympani, the inferior alveolar and hypoglossal nerves, and the submaxillary ganglion. The branches to the submaxillary ganglion are 2 or 3 in number. Those connected with the hypoglossal nerve form a plexus at the anterior margin of the hyoglossus. Its branches of distribution supply the sublingual gland, the mucous membrane of the mouth, the gums, and the mucous membrane of the anterior 2/3 of the tongue. The terminal filaments communicate, at the tip of the tongue, with the hypoglossal nerve. The inferior alveolar nerve, nervus alveolaris inferior, inferior dental nerve, is the largest branch of the mandibular nerve. It descends with the inferior alveolar artery, at first beneath the pterygoideus externus, and then between the sphenomandibular ligament and the ramus of the mandible to the mandibular foramen. It then passes forward in the mandibular canal, beneath the teeth, as far as the mental foramen, where it divides into 2 terminal branches, incisive and mental. The branches of the inferior alveolar nerve are the mylohyoid, dental, incisive, and mental. The mylohyoid nerve, nervus mylohyoideus, is derived from the inferior alveolar just before it enters the mandibular foramen. It descends in a groove on the deep surface of the ramus of the mandible, and reaching the under surface of the mylohyoideus supplies this muscle and the anterior belly of the digastricus. The dental branches supply the molar and premolar teeth. They correspond in number to the roots of those teeth, each nerve entering the orifice at the point of the root, and supplying the pulp of the tooth. Above the alveolar nerve they form an inferior dental plexus. The incisive branch is continued onward within the bone, and supplies the canine and incisor teeth. The mental nerve, nervus mentalis, emerges at the mental foramen, and divides beneath the triangularis muscle into 3 branches. 1 descends to the skin of the chin, and 2 ascend to the skin and mucous membrane of the lower lip. These branches communicate freely with the facial nerve. 2 small ganglia, the otic and the submaxillary, are connected with the mandibular nerve. Otic ganglion, ganglion oticum. The otic ganglion is a small, oval-shaped, flattened ganglion of a reddish-grey colour, situated immediately below the foramen ovale. It lies on the medial surface of the mandibular nerve, and surrounds the origin of the nerve to the pterygoideus internus. It is in relation, laterally, with the trunk of the mandibular nerve at the point where the motor and sensory roots join, medially with the cartilaginous part of the auditory tube, and the origin of the tensor veli palatini, posteriorly with the middle meningeal artery. Branches of communication. It is connected by 2 or 3 short filaments with the nerve to the pterygoideus internus, from which it may obtain a motor and possibly a sensory root. It communicates with the glossopharyngeal and facial nerves through the lesser superficial petrosal nerve continued from the tympanic plexus, and through this nerve it probably receives a root from the glossopharyngeal and a motor root from the facial. Its sympathetic root consists of a filament from the plexus surrounding the middle meningeal artery. The fibres from the glossopharyngeal which pass to the otic ganglion in the small superficial petrosal are supposed to be sympathetic efferent preganglionic fibres from the dorsal nucleus or inferior salivatory nucleus of the medulla. Fibres, postganglionic, From the otic ganglion with which these form synapses are supposed to pass with the auriculotemporal nerve to the parotid gland. A slender filament, sphenoidal, ascends from it to the nerve of the pterygoid canal, and a small branch connects it with the chorda tympani. Its branches of distribution are a filament to the tensor tympani and one to the tensor veli palatini. The former passes backward, lateral to the auditory tube; the latter arises from the ganglion, near the origin of the nerve, to the pterygoideus internus, and is directed forward. The fibres of these nerves are, however, mainly derived from the nerve to the pterygoideus internus. Submaxillary ganglion. Ganglion submaxillare. The submaxillary ganglion is of small size and is fusiform in shape. It is situated above the deep portion of the submaxillary gland on the hyoglossus, near the posterior border of the mylohyodeus, and is connected by filaments with the lower border of the lingual nerve. It is suspended from the lingual nerve by two filaments which join the anterior and posterior parts of the ganglion. Through the posterior of these it receives a branch from the chorda tympani nerve which runs in the sheath of the lingual. These are sympathetic efferent, preganglionic fibres from the facial nucleus or the superior salivatory nucleus of the medulla oblongata that terminates in the submaxillary ganglion. The postganglionic fibres pass to the submaxillary gland. It communicates with the sympathetic by filaments from the sympathetic plexus around the external maxillary artery. Its branches of distribution are 5 or 6 in number. They arise from the lower part of the ganglion, and supply the mucous membrane of the mouth and the duct of the submaxillary gland, some being lost in the submaxillary gland. The branch of communication from the lingual to the forepart of the ganglion is by some regarded as a branch of distribution, through which filaments pass from the ganglion to the lingual nerve, and by it are conveyed to the sublingual gland and the tongue. Trigeminal nerve reflexes. Pains referred to various branches of the trigeminal nerve are of very frequent occurrence, and should always lead to a careful examination in order to discover a local cause. As a general rule, the diffusion of pain over the various branches of the nerve is at first confined to one only of the main divisions, and the search for the causative lesion should always commence with a thorough examination of all those parts which are supplied by that division, although in severe cases pain may radiate over the branches of the other main divisions. The commonest example of this condition is the neuralgia which is so often associated with dental caries. Here, although the tooth itself may not appear to be painful, the most distressing referred pains may be experienced, and these are at once received by treatment directed to the affected tooth. Many other examples of trigeminal reflexes could be quoted, but it will be sufficient to mention the more common ones. Dealing with the ophthalmic nerve, severe supraorbital pain is commonly associated with acute glaucoma or with disease of the frontal or ethmoidal air cells. Malignant growths or empyema of the maxillary antrum, or unhealthy conditions about the inferior conchae or the septum of the nose, are often found giving rise to second division neuralgia, and should be always looked for in the absence of dental disease in the maxilla. It is on the mandibular nerve, however, that some of the most striking reflexes are seen. It is quite common to meet with patients who complain of a pain in the ear, in whom there is no sign of oral disease, and the cause is usually to be found in a carious tooth in the mandible. Moreover, with an ulcer or cancer of the tongue, often the first pain to be experienced is one which radiates to the ear and temporal fossa over the distribution of the auriculotemporal nerve. Section 29.